Hello and welcome to Histopath by Saba, your go-to channel for everything related to histopathology training in the UK. Whether you're starting your journey or looking to refine your skills, you are in the right place. I'm Saba and today we will be diving into an essential topic, preparing for histopathology training interview. Let's get started. So today we are going to break down everything you need to know to approach these interviews with confidence. Here's what you can expect from this session. We'll start by understanding the structure and format of the interview. Next, we will dive into the different stations and what they are designed to assess. Then I share some practical tips and tricks to help you to prepare for this interview. And finally, I highlight some useful resources to give you that extra edge in preparation. Before we begin, just remember, I'm not sharing any previous interview question. And the information is based on all publicly available resources, including HEE website. Okay, so before we get into the preparation for the interview, let's have a reminder of the steps that you have passed so far and what to expect from now. So all of you applied for the training application on Oriel in November. You provided some self-assessment score based on your portfolio. The long listing happened, which was basically checking your eligibility to apply for training posts, including like having CREST form or GMC registration. The step one shortlisting, which was something new, happened this year. So they checked the self-assessment scores, and basically if there were candidates who had scores too far away from the interview capacity, they've been excluded, and some of you invited to submit your supporting evidence for the step 2 shortlisting, and the evidence verification process happening from December to January, and in January you will be invited to book your interview. Just a quick look at the timeline for 2025 recruitment. By the time I'm uploading this video, the evidence upload window closed. In January, early in the January, you will receive your score after the panel reviewed your evidences. There is an appealing window for 72 hours, excluding weekends. So if you feel like the score they gave you is not fair, you can appeal. And then mid-January you will be invited for interview, and the interviews happening usually in the first week of February. So about interview booking and process, you have to book your interview on Oriel. It's first come, first serve. So if you have any specific time or date in your mind, make sure that you book it as soon as possible. Ensure that you book it before the stated deadline. If the deadline passed, they are not letting you to book the interview. Check the applicant user guide on Oriel for more details about the interview, and also they send you some instruction and steps before the interview date, so you can check your computer, your microphone, the camera, to make sure that everything is working and ready for the day of interview. Just about the process before the interview happening. So as you know, the interview happening online since COVID, there's a specific platform that they use. They send you a diagnostic check, and you should use the provided tool to test the connection on your chosen device, your computer, your laptop, to make sure that the camera, microphone, everything is working. If there is any problem, contact the recruitment team if you need more support. On the day of the interview, you have to log in 10 minutes earlier. You have to wait in the waiting area. Someone from the recruitment team will do your ID check, so you need to provide photo ID. Make sure you have them on your desk, and also they ask you to show the entire room. So tidy up your room, and yeah, make sure that your camera is moving to show the room. And yeah, just before the date of the interview, just make sure that your camera and microphone are functional and working. Let's take a closer look at the structure of the interview, which is divided into two stations, each lasting 15 minutes. So session 1 focuses on two keys. In question 1, you will be asked to interpret an image. So an image will be displayed and you will be asked some questions about 5 minutes. Question 2 is about histopathology as a career. It's about 10 minutes. And you will be asked questions about histopathology and also team working. Station 2 is composed of 3 questions and each lasting 5 minutes. They are assessing your clinical knowledge, your problem solving, how you can approach clinical error, and also audit. So this information is based on HE website, and you can see it on the HE website. So we will going through each of these sessions and questions and see what they expect you and what basically they are assessing in each of these stations. First of all, let's see what is the purpose of this question. So one, they are assessing your observation skills, so testing your ability to notice fine details, patterns, and different features. They are evaluating how well you can organize and articulate your thoughts. They are assessing your ability to infer meaning or context based on the visual clues. They are also assessing your communication skills in this question, how clear you can just communicate and talk about your thoughts and your findings. They also want to see how you approach abstract or unfamiliar scenarios, reflecting your reasoning skills and adaptability. So basically what they're looking for is systematic and structured observation of the image, clear and confident explanation of findings and interpretation, use of logical reasoning to explain your thought process. To excel in this station, it's important to adopt a structured approach, much like you would when interpreting a histology slide. Think back to your taster week or double heading sessions for guidance. Start by describing the broader features, just as you would examine a slide under lower power magnification, capturing the overall context first. Next, focus on details, gradually zoom in as you would with high power magnification, paying attention to finer elements like color, texture, patterns, or notable contrasts within the image. As you describe what you see, make sure to organize your observations logically. Avoid jumping between unrelated areas. Move systematically across the image, highlighting key features that are particularly significant or central to its interpretation. Finally, it's time to draw a conclusion. Summarize your observations to form a logical interpretation or diagnosis of the image. Your conclusion should bring all the details together into a clear and coherent understanding of what you have observed. By following this structure method, you will demonstrate your ability to approach the task thoughtfully and professionally. Okay, so let's move on to question number 2, which is histopathology as a career. First of all, the interviewer will evaluate your understanding of histopathology. This includes knowing its role in diagnosing diseases, the techniques that we use in lab like tissue processing, staining, and microscopy, and how the field integrates into the broader medical context. So your ability to articulate the scientific and clinical significance of histopathology will show them your depth of knowledge. Next, they will assess your genuine interest in histopathology as a specialty. So be prepared to discuss your understanding of the daily work, the challenges you foresee, and how your values align with the goals of the profession. So if you have experiences within histopathology department, or if you had a taster week. In this time, you can talk about your experience and why you are passionate and why you are interested in starting histopathology training. Next, the interviewer wants to understand why you have chosen histopathology as your career. So you have to share what drew you to this field, why it aligns with your skills and interests, and what you aim to achieve in the long term. So try to highlight the aspects of histopathology that resonate with your personality and also your professional background. So if you have any previous experience in research or teaching, you can talk about it, and you can show them that you have skills which motivate you to start this career. Next, histopathology, as you know, plays an important role in patient care. So interviewers try to explore your awareness of how pathologies contribute to accurate diagnosis and treatment planning, including the MDT. So make sure that you show them that you appreciate how the specialty directly impact patient outcomes and what is the role of histopathologists in MDTs. I posted a post on my Instagram account before about the role of histopathologists in MDTs and also the challenges of pathologists in the MDT. So just make sure that you review them and you are aware of some points if they ask you some question. And then finally, they will evaluate whether you have the qualities necessary to excel in histopathology. This includes your analytical thinking, attention to detail, and if you have an investigative approach. So you should also emphasize your ability to handle challenges. You can work in team properly, and also your communication skills. So by addressing these areas thoughtfully, you will present yourself as a well-prepared and passionate candidate for a career in histopathology. First of all, make sure that you review your notes and reflections from the taster week. So if you had any taster week, shadowing, or placement before in histopathology, please go back to your notes and reflect on the experiences and observation you made during those times. Consider what aspects of the field you found interesting or challenging, and be ready to discuss these during the interview. Also, think about your interactions with pathologists, technicians, biomedical scientists, or other members of the team. This will help you to understand the collaborative nature of the specialty. Try to do some research about the specialty. So I highly recommend you to visit the RCPAT website to understand the role of histopathologists in healthcare. Try to catch some information about training pathways, qualification, and career progression in histopathology, like different subspecialties like pediatric pathology and neuropath. Try to understand the future of histopathology, including the role of technology and AI. There are some YouTube videos, and there are some YouTube videos. Some of them are about the daily practice of histopathologists, so you can understand what's happening in the department, in NHS for histopathologists, and what is their daily work. There are some interviews with pathologists, so they talk about their career challenges and why they love the specialty. So it would be very helpful to give you more understanding about the specialty. And also the videos I posted so far on my Instagram account, definitely go back to them and review them. The next step, try to understand the skills and qualities needed. So reflect on the key skills required in histopathology, like attention to detail, being patient, the ability to work independently as well as in a team. And also be prepared to discuss how your own skills align with those required in the specialty. So try to think about how your past experiences like academic projects, teaching experiences, or placements demonstrate these qualities. As you know, histopathology is evolving with new technologies, including digital pathology, AI, and molecular techniques. So try to know about these developments and how they are changing the way diagnoses are made and treatments are planned. Okay, let's go to question number 3, which is clinical knowledge scenarios. This session is basically evaluating your knowledge, your general knowledge of diseases, plus your management approach in daily practice as a doctor. So you have to show that you understand the pathophysiology. So they evaluate your knowledge of how diseases develop at a cellular or molecular level and how this affects the body's functions. Then you need to demonstrate your ability to recognize signs and symptoms of different diseases, which helps in making a diagnosis. It's important also to show that you understand what investigation you have to order for different conditions and how you have to how you interpret the lab results, imaging studies, and histopathological findings to form a clinical picture. You may need to discuss evidence-based treatment options, including medicine, surgical interventions, and lifestyle changes based on the condition in the question. You have also you also need to show that you understand priorities in your daily practice when facing incidents or any emergency condition, how you prioritize your management plans. Okay, so I believe preparing for this question is quite easier because you may had the same scenarios in your medical interviews before. And also remember that at the end of the day, you are a doctor, you have completed medical school, and I'm sure that you have a broad understanding of common clinical scenarios. So just make sure that you review some common conditions. You can go through a few common scenarios from each system, like respiratory, cardiovascular, CNS, etc. So just go through a few common ones and know the basics. So for each condition, try to understand the pathophysiology, the clinical presentation, signs and symptoms, the key investigations. Make sure that you know how to prioritize your plans and also understand the treatment options, including surgeries, medications, etc. So question number 4 is about clinical error and audit. So when discussing clinical error in medical interviews, you always need to use the STAR format, which is composed of 4 steps. So S is for situation, so we have to briefly describe the context or scenario where the clinical error occurred, and this sets the stage for your response. T is the task, so outline the responsibility or objectives you had in addressing the error to minimize the impacts of it on patient or on the team. A is the action, so explain the specific steps you took to resolve the issue or prevent it from happening again. It's important to again mention that you can understand the priorities and you prioritize each action based on what needs to be done urgently, what needs to be done in the following hours, and what is your plan for the long term. And also make sure that in any clinical error, we have to do the incident reporting. R stands for the results, so describe the outcome of your actions and any improvement made, such as error reduction or patient safety. And then for the audit question, you need to know about the audit cycle. Just make sure that you go through this cycle and also understand the purpose of audits. So it's about quality improvement. So we are going to identify areas where the patient care or process can be improved. Also, another purpose is checking the compliance, so ensuring adherence to best practices, guidelines, and regulations, and also patient safety, minimizing errors and risks by monitoring and improving the clinical processes. So for preparing for this question, first of all, make sure that you learn the audit cycle. If you have any histopathology related audit, this is the opportunity to show off your CV. Make sure that you make yourself more familiar with audits specific to histopathology, which can focus on aspects like accuracy of diagnosis, turnaround times for reporting, sample handling and processing procedures, pathologist performance and consistency with the Royal College datasets, and also quality control in slide preparation. So you can search for papers and publications related to recent audits in histopathology to understand the common practices and methods and findings. So about the question 5, which is case study. So this question could involve any kind of case, including medical or surgical. So the approach is kind of similar to question number 3. So you need to demonstrate structure, problem solving, and clinical reasoning. Again, make sure that you understand the case, you quickly read, identify the key clinical problem in the case, relate the scenario to your knowledge of diseases, condition, treatments, or diagnostic tests, and try to apply your knowledge to suggest a possible diagnosis, management plan, or treatment options. Okay, so we finished the questions. Just to review some helpful resources. Again, I really encourage you to go to the Royal College website and YouTube channel. There are loads of videos on YouTube like osmosis, which you can review common medical conditions through it because they are quite short and they go through the pathophysiology, signs and symptoms, treatments, and so on. So I highly recommend to review common conditions with these videos. These 2 books, I recommend you to go through them. So the first one is about any medical interview. That's really helpful to prepare for stations like audit, clinical errors, and so on. And also a specific book for pathology interviews. So just make sure that you go through this book. This is written, I think, by one of the consultants in the UK, and it's a very helpful book for any pathology interview. And the last but not least, definitely my Instagram account. I highly recommend you to go back to my previous videos and highlights on my account because we went through some of these areas before in the daily practices of histopathologists. I talked about challenges, the role of histopathologists before. I will post more videos from now up to your interview date, but make sure that you review the previous ones. The last slide, tips to ace your interview. First of all, please dress smart because first impressions matter. Even if it's a remote interview, dress like you're attending in person because it shows that you're a professional doctor and it also boosts your confidence. You are eligible to take study leave for training interviews. So if possible, after booking your interview, just discuss it with your educational supervisor because it helps you to focus only on your interview. It also helps you to prepare and stay in the zone. As I said before, organize your desk and room, double check that your computer is charged, your internet is stable, and your environment is quiet and free from any distraction. keep your ID around, have your ID ready, so you don't have to scramble for it in the last minute. And at the end, please stay calm and confident, take deep breaths, stay positive and trust in yourself. You've prepared for this. You've passed all the steps so far, so please believe in your abilities because you've got this. So I hope you enjoyed this video and thanks for watching. If you found this video helpful, please like, leave me a comment, and also share with any friends that preparing for histopathology interview, and subscribe to my channel for future videos. Thanks for watching.